"Doc, I use AI to look up all my medications. I think I should stop 2 of them." And if he had done that without seeing me first, he could have ended up in the emergency room. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. My patient walked into my office last week and said, "Doc, I use AI to look up all my medications. I think I should stop 2 of them." He wasn't wrong about everything, truth be told. He knew about amlodipine causing ankle swelling. He knew about meloxicam not being great for the kidneys. He even came in with the names of alternative medications: diltiazem, losartan, lisinopril. But here is the problem. He was about to make changes to his own blood pressure medications by himself based on a chatbot conversation. And if he had done that without seeing me first, he could have ended up in the emergency room. Today, I am going to teach you how to use AI for your health without letting it hurt you. Because the genie is out of the bottle. You are going to use it anyways. I just need to make sure you use it safely and correctly. So let me tell you about my patient. Cadet is a man in his 50s. He's active, goes to the gym every day, lost 12 pounds through exercise and diet. He is on lisinopril for blood pressure, amlodipine for blood pressure, rosuvastatin for cholesterol, and meloxicam for joint pain. His prescriptions came up for renewal. They were denied. And while he was waiting, he did what millions of Americans do every day. He opened an AI chatbot and started asking questions about his medications. Now, to his credit, the AI got some things right. It told him amlodipine can cause ankle swelling. That's true. Amlodipine causes peripheral edema in up to 25% of patients at higher doses. It's one of the most common side effects of the drug. I've had to stop it several times in patients. The AI told him meloxicam isn't good for the kidneys. Also true, NSAIDs can impair kidney function, especially with long-term use. But then the AI started making suggestions. It told him he could switch to diltiazem, a different calcium channel blocker, to avoid the ankle swelling. It told him he could just take Tylenol instead of meloxicam and get the same results. And it told him that lisinopril can cause a cough and might not be good for his asthma. Now, here is where it gets dangerous. Cadet was ready to make all these changes on his own. Stop the amlodipine, stop the meloxicam, switch to diltiazem, all based on a chatbot conversation. But when he came to see me, his blood pressure in the office was 116/74. At home, it ran around 125 to 130. That told me something the AI could never know. He might not even need the amlodipine at all, not because of the swelling, because his blood pressure was already well controlled on lisinopril alone, especially now that he had lost 12 pounds. The AI gave him the right diagnosis. Amlodipine causes swelling, but the wrong solution. It suggested switching to another drug. The real answer was that he didn't need the drug at all. Going back to the Tylenol suggestion, Tylenol, which is acetaminophen, has been shown in multiple meta-analyses to have clinically insignificant effects on osteoarthritis pain compared to placebo. So taking Tylenol and taking a sugar pill was the same. NSAIDs are significantly more effective. So the AI told him to switch to a weaker medication and called it equal. That's not equal. That's the downgrade the AI presented as a lateral move. That's the difference between information and medicine. The AI has information. I had his chart, his blood pressure trends, his weight loss trajectory, his kidney function, his allergy history, and 10 years of context. The AI had none of that. So let's get into the science of AIs, chatboxes, and the healthcare landscape we all live in right now. Let me give you the data on what's actually happening with AI and patient health decisions, because this isn't just about Cadet. This is millions of people daily using chatboxes for their healthcare. A 2024 study published in the Journal of Medical Internet Research surveyed over 2,400 Americans. 22% reported using ChatGPT for health information. And here is the number that should concern every doctor in America. 31% of those users changed their medications based on what the chatbot told them. 1 in 3 changed their medications based on AI. That is staggering. Now, 81% of those users believe ChatGPT was just as useful or more useful than their doctor. 81%. But here is the other side. 68% of those same users admitted they were skeptical of the output. So they used it, they acted on it, but they didn't fully trust it. That's a dangerous combination. Another study in the British medical journal Quality and Safety tested an AI chatbot on the 50 most commonly prescribed drugs in America. The chatbot answered 500 questions about these medications. Overall accuracy was high. Median accuracy was 100%. Now, that sounds great, right? But when experts reviewed the subset of inaccurate answers, 66% were potentially harmful, and 22% could cause severe harm or death if patients followed the advice. So the AI is right most of the time, but when it's wrong, it can kill you. That's terrible. A 2026 audit published in the BMJ Open tested 5 popular chatbots: ChatGPT, Gemini, DeepSeek, Meta, and Grok on health questions in areas prone to misinformation. Nearly half of all responses, that is 49.6%, were problematic. 30% were somewhat problematic. 20% were highly problematic. And here is the part that matters the most. The chatbots expressed every answer with confidence and certainty. Out of 250 questions, there were only 2 refusals to answer. The AI doesn't say, "I don't know." It gives you a confident, well-written, wrong answer. Anyone who's been using an AI chatbot must have experienced this, but it's okay if you experience it when you're asking a question about how to get from here to New York. It is a different story when you are using it to manipulate your blood pressure medicines or diabetes medications. That can be flat out dangerous. So let's look into another issue. Where does the AI chatbot get the information? The median completeness score for citations was only 40%. Some citations were completely fabricated. The AI made up studies that did not exist and cited them as evidence. Can you believe that? This is called hallucination. You must have experienced that when using ChatGPT or any one of the other chatbots. The chatbot isn't lying. It's generating text that sounds right but has no basis in reality. Now, here is what the AI cannot do. It cannot examine you. It cannot check your blood pressure. It cannot feel your sinuses. It cannot look at your ankle and determine whether the swelling is from amlodipine, from heart failure, from a blood clot, or from the ankle you broke 20 years ago. It cannot cross-reference your kidney function with your medication list. It cannot weigh the risk of stopping a blood pressure medication against the benefit of eliminating a side effect because it doesn't know your blood pressure trends over the last 2 years. Cadet's AI told him amlodipine causes swelling, correct, but it didn't tell him that combining amlodipine with an ACE inhibitor like lisinopril actually reduces the risk of that swelling because the ACE inhibitor dilates the postcapillary vessels and normalizes the pressure that causes the fluid to leak out in the first place. So the AI didn't know that. It just said switch drugs. And here is the real danger. A JAMA internal medicine study found that when patients develop ankle swelling from amlodipine, doctors sometimes prescribe a diuretic, a water pill, to treat the swelling. But amlodipine-induced edema is not caused by fluid overload, it's caused by increased capillary pressure, so the diuretic doesn't fix the problem. It just adds another medication with its own side effects: falls, dehydration, kidney injury, electrolyte imbalances. This is called a prescribing cascade. And if a patient uses AI to self-diagnose the swelling, then ask their doctor for a water pill, they've just created a prescribing cascade driven by a chat box. Now, this is the part I would like you to understand real well. I am not telling you to stop using AI. That ship has already sailed. The genie is out of the bottle and it's not going back in. What I'm telling you is that AI is a tool, not a doctor. And like any tool, it can build something or it can break something, depending on who's holding it. And here is what AI is good for. It's good for understanding what the diagnosis means. If your doctor tells you that you have left ventricular hypertrophy and you go home and ask ChatGPT what is left ventricular hypertrophy, you're going to get a pretty good explanation. It's good for understanding side effects. If you want to know the common side effects of a medication before you start, AI can give you that list. It's good for generating questions to ask your doctor at your next visit. Here is what AI is bad for: making medication decisions, diagnosing yourself, deciding to stop a medication, deciding to start a medication, deciding to switch a medication, interpreting your own lab results, and replacing a conversation with your doctor. Medicine is a science, but it's also an art. It is based on relationships between the doctor and the patient's chart and the doctor's knowledge of the patient's medical history. I want to be your ally in this. I want you to use AI. I want you to come to your appointment informed. I want you to ask me hard questions. I want you to challenge me. Cadet challenged me and I respected him for it. But I also want you to understand that the 10 minutes you spend with the chatbot cannot replace the 10 years of context I have in your medical chart. So here is the deal I'm making with you. You do your research, you come prepared, and then we make the decision together. That's how medicine is supposed to work. Not you and a chat box making decisions in your living room at midnight. You, me, your medical chart, your blood pressure curve, and a conversation. So, as I leave you today, I want to give you 5 rules for using AI safely for your health so you don't hurt yourself. Rule number 1, use AI to learn, not to decide. Ask it, what does this medication do? Not, should I stop this medication? Rule number 2, never stop, start, or change a medication based on AI alone. Always bring the information to your doctor first. If the AI says something that concerns you, write it down and bring it to your next appointment. Rule number 3, check the sources. If the AI cites a study, look it up. If you can't find it, it may not exist. AI chat boxes fabricate references regularly. Rule number 4, remember what AI cannot do. It cannot examine you. It cannot check your vitals. It cannot see your labs. It cannot feel your abdomen. It cannot listen to your heart. It doesn't know your history. It doesn't know you. Rule number 5, your doctor is not your enemy. We are not offended when you come in with questions from the internet. We are offended when you make decisions without telling us, because that's when people get hurt. And our job is first to do you no harm. AI is the most powerful health information tool ever created, but information without context is dangerous. Information without knowledge is even more dangerous, and context is what your doctor provides. So use the tool, but don't let the tool use you. I'm Dr. Albert Takem. I will see you on the next one, because the fight for your health doesn't stop here. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.